Okay, good afternoon. It's a pleasure to welcome you to Medicine Grand Rounds. Today we have two speakers, Doctors Brooks Russell and Dr. Leventhal. Dr. Adam Leventhal is a professor of preventive medicine and psychology and director of the Institute for Addiction Sciences at the Keck School of Medicine at the University of Southern California. Dr. Leventhal received his BA degree from the University of California in Santa Barbara and his PhD from the University of Houston. He did his postdoctoral fellowship at the Center of Alcohol and Addictive Studies at Brown University. And he's looked at some very interesting areas that underlie tobacco dependence, obsessive compulsive behavior, racial discrimination, and depression. And he's characterized these in terms of the addictive personality and also ways to intervene. Dr. Ashley Brooks Russell is an assistant professor of community and behavioral health in the Colorado School of Public Health. She directs the program for injury prevention, education, and research in the School of Public Health. Dr. Brooks Russell received her BA degree from Case Western University and her PhD from the University of North Carolina. She went on to do a postdoctoral fellowship at the National Institutes of Health, at the National Institute of Child Health and Human Development, NICHD. Dr. Brooks Russell has focused on cannabis use and impaired driving, and also prescription drug abuse, especially in children and adolescents. So it's a pleasure to introduce both of these speakers to you, and I really look forward to this topic of how e-cigarette use in the youth can be affected, and how these children and young adults can be hooked at the various early stages of their development. Dr. Leventhal is going to speak first.
Sure. Well, thank you. Really appreciate the opportunity to speak to you all about this very important topic. And it's been a pleasure to collaborate with Ashley on this talk. So we will both be speaking today. Let's see. So to begin, just want to mention that we do have no disclosures or conflicts of interest to report. And this is going to be the genre for the talk. We will give a little bit of information about the history and background. We'll talk to you about the devices of e-cigarettes, what they are, a little bit about what's in them. Ashley's going to talk about the epidemiology of e-cigarette use amongst youth, both nationally and in the state of Colorado, as well as some policy issues and issues about prevention at the community and population level. And then we'll cycle back to me and I'll talk about some of the direct health effects and some practice implications for addressing youth e-cigarette use in medicine. So a little bit about the history. I think it's important because it almost feels like for some of us that e-cigarettes have been around forever, but if we cycle back, it really hasn't been that long, about a decade that they've been a topic of conversation in the United States. And so where does this come from? So taking you back to 2010, we knew that in the United States, a lot of people wanted to quit smoking. You can see 69% of American adults in 2010 said they wanted to quit smoking. About 50% said they had made a past quit attempt over the year, and of course, were unsuccessful because these are all current smokers in the survey, but very few used an intervention. And despite the fact that we have widely available FDA-approved pharmacotherapies, including a number of different formulations of nicotine replacement, as you can see here, the rates of use were very, very low. And so why is that? Well, one of the issues with nicotine replacement has always been is that the nicotine pharmacokinetics really don't mirror a cigarette. part of what makes a cigarette appealing and addictive is the the very fast increase in nicotine levels in the bloodstream. So you can see in this slide, the reddish line, that's the pharmacokinetic curve for blood nicotine in cigarettes. And then you compare it to all the different types of nicotine formulations in our medications, you can see that they do not mirror that fast spike and then the trough. And so it's possible that people weren't interested in using other forms of nicotine replacement because they didn't really replace the pharmacological effects that smokers were really seeking. So nicotine's important. Another thing that's important about tobacco addiction is that it's not just the nicotine in and of itself that makes conventional cigarettes addictive. It's this combination of the sensory stimuli, the sensations of smoke in the airways, the hand-to-mouth movements, the smell, the taste, all of those synergize with nicotine as an addictive drug, and the two together are a magic combination that makes nicotine so addictive, and much more addictive than you might expect based on the fact that nicotine, in terms of what we say, its primary rewarding effects, the euphoria that nicotine causes is not that high. And so really it's about the combination of the sensory stimuli and the nicotine, which makes it so addictive. And so going back to thinking about treatments for nicotine dependence, well, smokers are missing the sensory stimuli, not just the nicotine, but the sensory stimuli. So about 15, 20 years ago now, someone asked the question, what if there was a less toxic product that delivered both nicotine and the sensory stimuli that was just like a cigarette? And lo and behold, someone in China invented the e-cigarette. And so this is where it came from. It was all about smoking cessation, trying to come up with a substitute. There wasn't much thinking about youths back then. But as we will talk about in this presentation, is that there's been a big technological and cultural evolution in terms of the industry in a product that originally started out as a harm reduction tool, a less harmful version of getting nicotine. And it's really advanced into this new form of recreational substance use that's been concentrated amongst youth. So I think now's a good time to go with our first poll question. So if y'all could start the poll, that would be great. Okay. Multiple choice. And I'll give you a hint, C is not the answer because you always want to pick C in multiple choice, right? But maybe not this time. So I'll let you, the votes come in. I'll give it a few more seconds. Wow. Smart audience. 98% got it right. Now, granted, that was an easy one. I think that they'll start to get harder. Thank you for your participation. So yeah, there are a lot of terms for e-cigarettes. And so just a definition, so vaping is the act of inhaling an aerosol produced by heating a substance to the point of aerosolization, but lower than combustion. And that's the whole point about the potential less harm of e-cigarette aerosol. You're not burning the substance like you burn a cigarette or burn the tobacco and inhaling smoke. You're heating it to aerosolization, and therefore there's less kind of chemical reactions that take place that would create less toxins in the emissions. And so it really can be applied to any types of substances. But we're going to be talking about nicotine today, but here are some terms: e-cigarettes, vaporizer, pod mod, juuling, vape pen. Also talk about puff bar. So these are different brands and terms, but they all mean the same thing, essentially, heating a substance to aerosolization. And I could spend a whole talk talking about what's in e-cigarettes, because there's a lot of things in e-cigarettes, and it varies from product to product to product to product. And I'm showing you this picture here of, these are e-liquids that you would load into a device to vape. They have ingredients, right? But almost all of the products out there don't. So I wish we did have ingredient listings like we do for food, but we don't really know what's in them. And that's an important thing. That's an important take home message, is that to all of y'all out there with your patients, one of the issues with e-cigarettes is that the consumer just doesn't know exactly what they're putting in their body. So they must do so at their own risk. But nonetheless, they all, nearly all of them have propylene glycol or vegetable glycerin, which is a vehicle. And so it's safe to ingest. It's in some foods like Twinkies, but in terms of safe for inhalation, we don't know. Nicotine, flavorants, and some other additives. And then they can have cannabis too, but that'll be for another talk. So let me switch it over to Ashley.
Thank you. So there are many different devices. So I'm going to quickly take you through a history of the generations of devices that have come on the market. So in the next slide, you can see what we call, and Adam, unfortunately, will have to drive over here, the first generation, the Cigalites. And this was the first iteration. And given the history and trying to be a substitute, you can see they looked and felt like a cigarette as close as you could get. And they were disposable. So it's like one use thing. And then next, the next generation that came on the market are these refillable pens, where you could, put the liquid into the cartridge here, but in all sorts of different shapes, sizes, colors. And then the next generation to come on the market are these tanks or mods, and the mods is short for modifiable. And these were rechargeable and refillable. Anything to add here, Adam? Feel free to jump in.
I mean, I think you'll see is that they're looking less and less and less like cigarettes over time, right? And then some of you might notice you're like if you're on the street and you see someone pull up next to you in a car and they have like what looks like a fog machine in their car. They're usually these tanks or mods. They're very powerful. Their batteries are very strong. And so because of that, they can create a lot of aerosol in them. And so this is a person doing a vape trick with their aerosol.
But then what's really captured, right, the public's attention and concern is this fourth generation pod mods. And this is what, I think this is when everyone sort of woke up and started paying attention. And specifically this brand, one particular brand, although there are many brands, but Juul noted on the right, highlighted on the right. And this is where we start to see a lot of concern about youth vaping. And again, many different sizes and shapes and colors. And as you point out, Adam, even less like a cigarette at this point. And at this point, we start to see the brand name Juul actually become synonymous with the act. So now it's not just the verb vaping, but juuling as a verb. And I think that's when, that's another mark of how this has entered popular culture.
Right. And then the thing here, other thing
I got to note my internet's unstable.
Okay. Yeah. Yeah. We still see you, but but yeah, we can still hear what you're saying, Ashley. The thing to note here is then this is, so, the big one, so the previous one, big device, lots of big cloud. Juuls are a little bit different. They're kind of like the every person's e-cigarette, and you can do them much more discreetly. So of course, this is a child vaping secretly in school. And so it's really kind of captured the adolescent population's attention, I think, with these.
Yeah. And you can see popular press talk about how teachers thought they were flash drives and how students will slip them in their sleeve. And there's even a market of clothing designed to discreetly hide or store a device, near the mouth. So lots of innovation happening in the marketplace at this point. And now we're in generation 4.5. Actually saw my neighbor using one of these just last week. So these are disposable pods, and you can see here, I think it's even on perhaps the next slide, or the price that, this is approximately equivalent of what a pack of cigarettes, might be. So priced where they can be disposable. And of course, fruit flavors being highlighted there.
Yeah, right. And I think so it's almost come full circle, right? But there's very few barriers now. A Juul set, I forget how much it costs, but it's $30 plus to get started on Juul. And then some of the previous ones, those bigger devices can get very expensive. But here, just like a pack of cigarettes, you just rip open, vape it, and then toss it away. All you need is $8 to get in, and then you're promised watermelon, pomegranate, strawberry, banana. So yeah, it's a concern.
Yeah. Well, next I want to highlight what we know about what's happening with youth today, using the main source of national data is the National Youth Tobacco Survey, which is conducted annually. And then in Colorado, we have the Healthy Kids Colorado Survey, which is our state's administration of the Youth Risk Behavior Survey, which is a national youth surveillance system. And so I'm going to present data from both of these. So this is what's going on nationally. And you can see, looking back to 10 years ago, when these products were nearly unheard of, and we really thought of them as alternative to cigarettes. And, there's a whole range of alternative tobacco products, but very low prevalence. And then over the decade, you see this really remarkable rise. And it has ups and downs, but a very dramatic rise here to 2020, which is the last wave of data from the National Youth Tobacco Survey. Among high schoolers, it's 1 in 5, nearly, just about 20% of high schoolers. And with a similar rise among middle schoolers, with about 5% of middle schoolers. We see this little drop from 2019 to 2020, which we can talk about and may circle back to another slide. This may reflect a reaction to the outbreak of lung injury. And you may recall seeing that just really daily in the news in 2019. So it's not clear yet if that's going to stay that way, if we're going to see an uptick again, and how COVID and youth staying at home, how that might be affected as well. But clearly the trend over the decade is just dramatic rise.
Yeah, and then here just you can very track how the industry plays a role and how the products have evolved, and as they evolved, the youth use increases. And then I think here we saw a little bit of a dip. And at that point, the word's getting out, because before then, people were just thinking that they were vaping just water vapor, right? And a lot of the youth didn't even realize that e-cigarettes had nicotine in them. And then, so there's a little bit of a dip, but then Juul turned that around. And one of the key things about Juul is that has a very high concentration of nicotine, and a novel formulation of nicotine that allows it to be very potent, but also not be as harsh and as bitter as previous products when with high nicotine concentrations. So, and then I think, yeah, with 2020, it's looking in the right direction, but just a caveat is that the surveys had to be cut off because of the pandemic. So it's a partial data set, and then there's another data set out there that doesn't, a national data set that doesn't show such a dramatic reduction. So I think that we can hopefully be cautiously optimistic, but we need to continue monitoring this trend.
Yeah. And this is just to put it in perspective. I mean, for folks who have been working in tobacco control for, a decade or more, we've had a sea change, and it's hard to really appreciate that cigarettes are the alternative product now for youth, and e-cigarettes are the tobacco product for youth. I mean, many times more our teenagers are using e-cigarettes than cigarettes. And so if that message hasn't gotten out yet, that, just to underscore that point. And there's a lot of poly substance use going on, of course, with teens experimenting with multiple forms of tobacco and using them, within the month. And a lot of concern with e-cigarettes being this introduction to cigarettes, which would sustain, dependence into adulthood. All right. And then I want to highlight, flavors and the importance of flavors for youth. This figure from the National Youth Tobacco Survey shows, fruit and mint and menthol and candy and chocolate, and just predominantly youth are using flavored versions of these products. They're not choosing the tobacco flavored version, and it's clear that flavors have this role of making the products more palatable, and so it's not a surprise that these flavors are very popular, and it's a very critical role in youth e-cigarette use. I want to just mention, as you could see with the difference middle school to high school, e-cigarette use increases in a pretty stepwise fashion throughout high school. And so when you see a number like 20% of youth using e-cigarettes in the past month, underneath that, you can see, if you're looking at high school juniors or seniors, it's really closer to a third, or at least 1 in 4, 1 in 3 students. So it's really a large number of our high school students, upper class high school students using these products. And this might be a good time to launch the second poll.
Yeah.
So some local trivia for you here.
While they follow the poll, like Ashley, and these numbers are remarkably similar to the nation. Like Colorado seems to be like right in there, Right.
A few years ago, we were much higher than the nation, and it seems that we've stabilized in Colorado, and the nation is unfortunately caught up. Yeah, we're lucky in Colorado with the Healthy Kids Colorado survey, which is funded by the state health department and supported by other state agencies. We direct that data collection here at CU Anschutz, and we're lucky that we have regional data so we can actually see the results. So, we have an educated audience here with Pueblo coming out in the lead, but some concerns about Boulder and Colorado Springs and Denver.
Well, I don't even know what I probably would have guessed. I don't know.
Yeah. So on the next slide, so our Healthy Kids Colorado data does provide us the ability to look regionally. The state has been divided into 21 regions, and we can come up with representative estimates. And Pueblo is dramatically higher. So, again, looking under the hood, the last estimate we have of the prevalence of e-cigarette use from the Healthy Kids Colorado surveys from the fall of 2019, and it was about 1 in 4, and in Pueblo it's higher, and then some of the other cities are a little bit lower there. So again, this isn't consistent across the state. And then if we look at some racial and ethnic differences in the state, I've asterisked the groups that are different as compared to white non-Hispanic as a reference group. So we do see the African-American and Asian youth across the state are a bit lower there, with American Indian, Alaska Native youth, Native Hawaiian, and Pacific Island youth being a bit higher there. So
oh, sorry, I don't know why.
Yeah, go ahead.
No, I'm just saying, and that looks, it kind of looks similar nationally a little bit too. One thing I've noticed about like racial and ethnic differences in e-cigarette use over time is like you don't see a consistent trend. Like some years, the Hispanic youth are higher than whites. Other years they're lower. The Asian youth do seem to be lower. African Americans lower, but sometimes I've noticed a trend by 2020 they seem to have by 2019 they've been kind of increasing. So no clear kind of pattern of disparities, I think, at this point.
Yeah. And this would be a good time for me to plug our state resource of, there's a data dashboard hosted on the State Health Department's website, CDPHE. If you were to just Google Healthy Kids and CDPHE, it would come up. And from all administrations of this survey, at least going back to 2015, you can look at any of these items regionally, by grade, by gender, by race, ethnicity. And so if there's any question you have on the epidemiology of this, it's all available from our state, which is so wonderful as a resource. So now that we have a sense of the reasons behind and the scale of this problem, we should turn our attention to what we should do about it. So I want to spend a few minutes talking about some of the policy implications here for prevention and addressing this problem. And so there are many aspects to prevention in this landscape. We've got issues of access and availability, use in public, which leads to a social norm, and the cultural considerations related to that, perceptions of vaping as lower risk, which is, has a nuanced answer because it in fact is or can be, but is not no risk. Issues of marketing, and then the regulatory environment, which at the current moment is complex and evolving as the FDA finds its footing on what to do about this. So let's look at a couple of these spheres in a little bit more detail. So first, we're going to look at access and availability. Let's go to the next slide, and for youth in particular. So when we ask high school students in the state, how easy is it to get e-cigarettes compared to other products, we have separate questions about each of these products. It's not surprising that a majority, just over 60%, say it's sort of or very easy to get e-cigarettes. It's not that much higher than some of these other substances. Basically, youth perceive that it's quite easy to get a number of these substances. It's not strikingly more easy, but nonetheless, youth do feel that it is easy to get these things, which isn't surprising with so many of them using it. And then we also ask them on the next slide where they get them. And in fact, some may think they're buying them in stores. This isn't the predominant way. We don't see a lot of underage youth who are not legal age to buy, but going into stores or getting them on the internet. Those are, at the end of this figure is pretty uncommon. What we see is a lot of borrowing, giving someone money to have them purchase these products for them, or someone bought them for them. So that's by and large how this is happening. So it's a peer-to-peer, and I just have to imagine there's a lot of 21-year-olds out there who are doing a lot of purchasing for their friends who are not old enough, and that's the predominant way that youth are getting these products.
Dealer.
Yeah. Yeah. So I mean, there's a little bit of a silver lining here in that. Of course, ensuring compliance with retail sales is very, very important, but perhaps there's just a bit of a silver lining here that the problem's not enormous with the retail sales.
Yeah, I mean, and it's gotten better. Like not so many years ago, you could purchase a big batch on Amazon, right? And so there's a lot of regulatory issues around this. And then I think probably most everybody in the audience knows by now, but as of January 1st of last year, right, you have to be 21 to purchase tobacco products in the nation, which is a big change. And e-cigarettes are included in that in terms of the legal age.
Right, it's important. So let's talk about marketing and culture. So when Juul first appeared on the scene, around, 2014, 2015 or so, some of their marketing, was clearly intended for young adults and not as a cessation aid, more as a party aid, I would suppose. And, they were big users of social media and organic advertising, as it's called, and it's been documented that they had Instagram influencers that they tapped to do this kind of viral marketing. This is a great example. And luckily, researchers at Stanford have archived much of this, and there's just I think thousands of images, tweets, and Facebook and Instagram posts that's been documented that they engaged in these marketing practices. And,
Right.
and on the next, yeah, so yeah, this is just an example of some of this kind of underground
I think just
marketing.
one other thing is it's just, and it's you can't stress how much like the role of social and digital media now in this epidemic of e-cigarette use. Because even though Juul has changed their marketing practices, and they really do not, they used to use a lot of people, you know, who look very young, right? Young adults. So they don't use those people anymore from what I can see now in their advertisements. But it doesn't matter, right? Because once you put it out in the social media sphere, there's retweeting and whatnot. And then there's these hidden ways of Instagram influencers where this person's actually, this person might be getting paid by Juul to promote their products. And then as far as the teens know, if they follow these Instagram influencers who they like, they just think that the person really just likes the product, not that they're actually getting paid to market it. So yeah.
Right, great endorsement. Yeah, and I've heard rumors that Pueblo, Colorado was actually a site for some of this underground marketing, and that some of the increased prevalence there is partially attributed to some advertising practices. And I just want to, this is, you know, the last image of some of these marketing, just to show the fun-loving, diverse young adults. And just, you know, if anyone had a misconception that, you know, cigarette or tobacco advertising was banned, there wasn't, you know, federal restrictions on TV, radio, and print and digital advertising for e-cigarettes. They weren't, you know, 2015, they weren't regulated like other tobacco products. So that we can attribute some of what we're facing today to this this environment from years ago.
Right. Yeah. And I guess the other thing is, you know, by now I think, you know, obviously medicine knows the clear role of the cigarette industry. And you know, causing the tobacco-related disease epidemic. Well, you see a similar strong role by the e-cigarette industry. And the other thing, I think, in addition to big, we call it big tobacco, right? And there's big e-cigarette, which is Juul, which is actually kind of, I think, partially owned by Altria, who makes Philip Morris. It was Philip Morris Associated makes Marlboro cigarettes, but there's also kind of like more on the ground grassroots. So you kind of have the big economic interests above, and then you have like this culture happening where there's these vape shops selling these independent products like artisan e-liquids, and creating a culture of vaping connoisseurs. And the vape shops themselves are cool places to hang out at. And, you know, there's advocacy groups, there's e-cigarette conventions. So really kind of the industry is multifaceted in its role in e-cigarette uptake amongst youth.
This is probably where we see another place of intersection with cannabis and the rise of big cannabis industry and the rise of vaping cannabis, and these things and these two things can feed off each other in terms of the rise in the culture.
Right.
So what we know is that youth say that they are exposed to advertising. 73% of high school students in Colorado say they've seen some ads for e-cigarettes in the past month. Stores are a big source of that, and internet and television. So, you know, it'd be disingenuous to say these products aren't marketed still somehow to youth. And, you know, if they're trying to avoid this demographic, they're failing, because the youth are very much being exposed to marketing still. All right, so, you know, there's some policy implications here. There's a lot happening on the federal level, and of course there's a role for federal and state policy as it relates to price increases at the state level. Federally, you know, the FDA has a role in setting nicotine concentration levels, perhaps the possibility of, you know, restricting those or restricting the sales of, you know, higher concentration nicotine products. And then a lot of discussion that's happening about flavor restrictions. And and what level those should happen and how those should happen. There's also a role for local policy. And I just want to plug and give a shout out to the Policy Technical Assistance Team at the Center for Public Health Practice here at the Colorado School of Public Health that is working with local municipalities to look at what kind of local policies can be implemented or passed and implemented in order to ensure that compliance happens, that it happens equitably, and how to enforce that. Some of the things that they're looking at are flavor restrictions locally, density and zoning in order to limit where and how tobacco is sold. And just that the local policy community has a great role in communicating the importance of this and setting sort of the tone. I mean, there's with this big cultural shift, that's a lot to counteract, and local ordinances and local leaders can do a lot to set the norm that it isn't acceptable and that we want to prevent youth tobacco use. So if anyone is interested in working with their local community, I encourage you to reach out to the Center for Public Health Practice on what they can do to advocate and support activity going on in the state.
Yeah, I know. Yeah, physicians and other healthcare providers, they have a strong voice, and some of these organizations, American Academy of Pediatrics has had a very strong influence on these type of policies nationally. So just a plug for that. I'll talk about health effects and some of the practice implications. And I wish I had a lot of stuff to talk about, but because these products are new, we don't know a ton, but this is kind of what we know from a consensus report by the National Academy of Sciences, Engineering, and Medicine. Okay, so to sum up, a very large and evolving and complex literature, e-cigarettes are likely to be less harmful than cigarettes. Okay, but they are linked with adverse effects on the developing brain due to nicotine. So we know that nicotine exposure during adolescence may increase people's risk of developing mood problems, attention problems, and other types of psychological issues. Addiction, we know that. It's very clear that e-cigarettes are addictive. Respiratory symptoms, we have a good amount of data now to suggest that, especially in youth, there is an association there between a wheeze and potentially asthma exacerbations. And then the thing to kind of talk about is it's very tempting to think about a continuum of risk, which is very important, where you have air on one side and then you have cigarettes on the other, and then e-cigarettes are somewhere in the middle, and that is true. And then, but you know, there's a quantitative difference between e-cigarette aerosol and cigarette smoking and potential harm, but there's also qualitative differences. E-cigarettes have certain components and constituents that cigarettes don't have. And so because of that, we don't know exactly what the long-term health effects will be. We know that e-cigarette aerosol is active in the cardiovascular system. And we'll just need to have long-term follow-up to see whether people who use e-cigarettes for decades do develop some of these diseases that people are concerned about. Just a quick thing about EVALI, e-cigarette or vaping product associated lung injury. So many of you recall this outbreak that happened a couple of years ago. And so just one thing to clarify is that it is most likely associated with vitamin E acetate, which is an additive in a particular type of marijuana e-cigarette product. It's not in all marijuana e-cigarette products or marijuana vaping products. And I think it's probably been eradicated at this point. But I think there are some questions where people think, oh, they should stay away from e-cigarettes altogether because of this. It's unlikely that all e-cigarettes were responsible for this lung outbreak. Oh, here we go. In terms of interventions, this is another thing where we just need more data, but the USPSTF for tobacco interventions for youth, they give it a grade B for prevention. And so that can be in the form of video, print, or in-person counseling. In terms of getting people to stop, getting youth to stop and cessation, there's an I statement there. And so that means there's insufficient evidence. It doesn't mean that the interventions might not work. But in terms of balancing like the benefits and harms being in just terms of like the cost of in terms of time, there's not really any evidence that especially a behavioral intervention would have any physical harm to your patient directly. And you know, this is just based on a lot of this literature. So that came out in 2020 is interventions for e-cigarette use. But there's very little evidence for e-cigarettes. In terms of some of the evidence, some of you might be familiar with the 5 A's: ask, advise, assess, assist, and arrange. So, you know, asking your patients about tobacco use, including e-cigarettes, you know, urge people to quit. So, you know, we're talking about youth. We want people to quit using e-cigarettes or avoid starting. And so this also works for prevention. You know, see if they're willing to make a quit attempt, provide or refer for treatment, and then schedule a follow-up. And then as a side note, pharmacotherapy, while effective in adults, the adolescent literature is not very robust in terms of showing their efficacy, but the behavioral interventions, there's a lot more support, especially in the prevention end. But in terms of what's out there, I suggest that you all go to Stanford, the Stanford Tobacco Prevention Toolkit. They have something, they have a module now on e-cigarettes, and it's very informative. So if you're ever asked to give a talk about e-cigarettes in the community, you might consider using some of their tools, or get asked about parents about information. You can send them to this. There's an application by the Truth Initiative that teens and young adults can use to quit vaping. It's free. They just text "ditch vape" to this number. You know, the initial evidence looks promising, but there's not a well-controlled clinical trial at this point. But it's unlikely that this could cause any harm, so offering it to your patients. And then the Colorado Quit Line, it's a very good resource for adults, of course, in smoking cessation. But when I did some research, I was very pleased to see that there's a whole, there's opportunities for youth to call the Quit Line and get help to quit vaping too. So that might be something to consider in terms of your referrals. So anything else to add before we go into question and answers, Ashley?
Oh, that's great. Thank you. And I think we did okay on time too.
I'm good.
No, this was a great discussion. Thank you very much. We have a lot of questions. Let me just start with sort of big picture questions. Talk a little bit about the FDA regulation of cigarettes, how it applies to e-cigarettes, and what about taxing of e-cigarettes?
Yeah, Adam, do you want to start with that?
I'll do the FDA, yeah.
And also how effective taxing of e-cigarettes would be in terms of decreasing the use, use of e-cigarettes.
Okay, well, I'll do FDA, and then Ashley, you can handle taxes.
Yeah.
So the FDA issue, the next 9 months will be very telling, because there was actually all e-cigarettes that are on the market are on the market illegally. Actually, none of them have gone through FDA authorization to be sold. The FDA just is practicing what they call enforcement discretion, allowing these products to stay in the market until they developed a system where they could actually take the applications and process them. And so there's a deadline, I believe it's later this year, whereby the FDA stated that if you don't have an authorization to market and sell your product, we will take you off the market. And there's one caveat to that, is that earlier last year, they said that even though we're practicing enforcement discretion and we're allowing all these companies to sell their e-cigarettes, we're going to target a specific type of e-cigarette, which was like a Juul, Juul's included, whereby flavors other than menthol or tobacco and these Juul type pod style cigarettes, we will enforce discretion on them. And it's possible that that could play a role in some of the reductions in e-cigarette use we saw in 2020. But again, that's tentative. So complex question, complex answer. Hopefully we'll know more later and into 2021. There should be probably a lot fewer products on the market.
And with price, I'd say there's pretty robust evidence that increasing the taxes and thereby increasing the price is a way to affect smoking prevalences. We know that from cigarettes. So that would be a good strategy to use with e-cigarettes, because we know that youth are also more sensitive to price increases. But I would also say that it should be just one part of a plan. There's some concerns about equity there, particularly for people who are, already dependent on tobacco products. It's a regressive nature of that, in asking them to continue to pay more. So it should just be one piece of a multi-pronged strategy. But certainly youth, you can estimate, with this, this much cents or dollars increase, this is the expected decrease in prevalence. I mean, there's been meta-analyses done to project that. So tax increases do work. Yeah.
And give us your opinions about use of e-cigarettes as nicotine replacement products, and the proof that they can be used as nicotine replacement products, and also the cons in terms of using them as such.
Sure. Yeah. So to help people quit smoking regular cigarettes, right?
Right.
Yeah. Generally, if you have a patient out there who wants to quit smoking, you want to refer them to an FDA approved product. So there's, Chantix medication, there's Zyban, bupropion, and then, there's a number of different nicotine replacement therapies, the patch and gum and lozenge. All those are efficacious. And of course, there's counseling. So counseling plus medication is likely the best, most robust treatment. And, mentioned the Colorado Quit Line, where you have a patient who has tried everything. They've tried all the drugs, they've tried the counseling, nothing works. They can't envision a life without inhaling nicotine every day. That's a patient where trying e-cigarettes is worth considering. And there is evidence that, if you substantially switch from combustible cigarettes to e-cigarettes, you do show a reduction in exposure to toxins, which means that likely there could be some reduced risk of some of the diseases we're concerned about. In terms of the efficacy of offering it, the evidence is still accumulating. We have there was a very large trial in the UK which did provide good evidence, actually, that e-cigarettes can help people quit. And probably one of the key roles is because, as I was alluding to earlier in the presentation, with some of our other smoking cessation medications and interventions, people stop using them. They don't find them appealing. Their side effects, whatnot, but then people are more likely to find e-cigarettes appealing, but not all smokers. And we haven't seen like a massive uptake of e-cigarettes amongst adult smokers. It's mainly been a lot of kids. So there is some, not rock solid, but suggestive evidence that they could be efficacious and can result in a reduced harm for that kind of, for those smokers who, might be unwilling to quit otherwise through other means.
And I would just add, youth are not using e-cigarettes to quit smoking cigarettes. So it's like the answer for adults versus the answer for youth. It's the concern is that by starting e-cigarettes, they're gonna then experiment with cigarettes and either be using both or,
Mm-hmm.
or yeah.
how does Juul and other manufacturers of e-cigarettes relate to the tobacco industry? Um, so is it, are, are these overlapping industries, or are they completely separate industries? And how do they lobby Congress?
Adam, do you want to take that?
Yeah,
I'm not sure on
I,
lobby.
yeah, I think there's a lot of overlap, right? A lot of the widely sold e-cigarette brands are the same. You know, there's overlap with Philip Morris, which sells Marlboros, and then RJ Reynolds, which sells Camels and whatnot. And so there's really kind of two components to the e-cigarette industry. There's those kind of big business where it is a lot of overlap, and then there's you know, the more kind of grassroots where those people, those ones are often using like the larger tank style devices, and, you know, and smaller businesses developing e-cigarette liquids. But, you know, in terms of the e-cigarette epidemic, I think we can say in youth that, you know, kind of big tobacco played a large role.
And in the elderly or in middle age, are there, do you see a shift of consumers from the tobacco industry to the cigarette industry?
Yeah. I mean, and so I can take that. I just know the epidemiology is that the e-cigarettes are one of those double-edged swords, right? They could be good in some circumstances, and you know, and we're talking about in youth, they're bad, right? Yeah, the epi, like, you haven't seen the uptake of e-cigarettes and amongst adults hasn't been substantial, but some definitely have. You know, probably the younger adults and some of the maybe people like in their 30s, you do see from time to time, there are some older adults who do switch to cigarettes. But in order for them to have a much positive impact on public health, you do want to see a lot more uptake and switching in adults and less in youth. But we're not seeing a ton of that.
Mm-hmm. And tell us a little bit about the psychology of flavoring e-cigarettes. You know, it almost reminds me of what was done with menthol cigarettes to make it more appealing. And is that, I mean, why do people want their e-cigarettes to taste like bubblegum or whatever, strawberries? What's the appeal there?
Go ahead, Ashley.
Well, I don't know. I mean, what isn't appealing about that? I don't know.
Yeah, right. Yeah.
Yeah. I mean, there's also a kind of a chemistry aspect to it that probably, you know, I'm not equipped to speak to, but related to kind of the irritation, right? I mean, and salts and things. I don't know, maybe Adam, you know more about that, but I understand there's some kind of chemistry aspect to it that.
Mm-hmm.
But is it related to sort of yet another addiction, I guess is what I'm trying to get at, is related to our addiction to sweets and things like that. And are they trying to combine addictions in terms of addictive personalities?
It's very interesting.
Yeah, you know, and that's something, there's not a lot of literature on it, right? But like you've heard anecdotally, people do report like, oh, I will vape like a whatever, a bubble gum vape instead of snacking, you know, because it helps me with my food cravings. So there's certainly some overlap there. And just like you said, you know, anything that creates those perceptions of sweetness, it activates the same parts of our brain, the addictive kind of pathways, as chocolate might and whatnot, and then you add on nicotine too, which does it pharmacologically. That's kind of a concern, and I think, and Ashley hit on something that's big, is that, you know, the flavors help the nicotine go down, right? And so menthol does that in cigarettes. It does it in e-cigarettes. The sweet flavors to some extent as well. Yeah.
I think that's very interesting, that those connections. Yeah.
The marketing, right?
So let's end by talking a little bit about addictive personalities and how we as clinicians can nudge people uh, to move in the direction of less addictive personalities. What are the key features of who we need to traits of what we need to recognize in the clinical setting, and when can we handle those addictive personalities and move them in the right direction, and when should we reach out for help?
And are we talking, David, are we talking about like nicotine anymore or just more broadly to?
I'd focus on nicotine, but then speak more broadly. I think I would imagine that these are overlapping personalities, but,
Yeah.
but I don't know anything. I don't know much about it.
Okay. Yeah, I'm happy to talk about that. Yeah. So the addictive personality, there's not just one, there's many, right? And so that's just kind of one thing that to point out. Some people engage in drug use because they're motivated, because they're pleasure seeking, adventurous. There's other people to cope with stress and negative affect, and they could be, you have one person who's extroverted and the other person who's introverted, but they both could be prone to addiction because of these various kind of tendencies. I think, so personalities are stable, right? So that's what makes them a personality. So in terms of like a big picture clinical thing, you're not going to change someone's personality. So if someone has a propensity to want to fill some sort of a need, right? Whether it's, anxiety suppression or having fun, or pleasure or excitement, then probably interventions and moving them is to kind of think about what could they have as a substitute. And it's not like I think it's not a surprise, but in terms of pharmacotherapy, some of the most effective pharmacotherapies for all the different types of addiction, a lot of them are agonist type treatments. Like that's what nicotine replacement is nicotine, right? Same thing with some of the opioids. So, there can be behavioral replacements to exercise and other types of rewards for not using. So I think that's just something to think about when you're approaching this with a patient. It's not just like, okay, we want you to give this up. It's time for you just to give it up, right? So like, okay, how can I help you give this up? And then can we do this so that you're not going to feel like you're missing something in your life? And kind of one last final point about this is that sometimes people get concerned about people who have another substance use disorder, like maybe alcohol use disorder or a drug use disorder, that you don't want to help. You don't want to tell them to quit smoking because, oh, well, like you can't take away everything that they want. I was kind of alluding to that a little bit, but that's not true. The evidence suggests the opposite. When people are in a motivated state of change, it actually can benefit them. They could quit both substances. So that's just kind of another piece to consider.
Ashley?
Well, I don't know if I have much to add, not being a clinician myself. I'm very focused on teens. I think the challenges with teens are different with adults who maybe have decades of dependence experience and just the significant challenge that is in someone's life to quit smoking. And I think the trick with teens is the sooner the better, before all those pathways in their brain have been cemented. Just early intervention and early prevention is really key. Because the earlier someone starts using, the increased risk for adult dependence. So,
and when should we seek help? In other words, when should we as clinicians seek help for our patients? So,
from a mental health professional in particular. Yeah.
When does an addictive personality?
Yes.
Further intervention?
Okay. All right. Yeah, that's a great question. for all different types of medicine, internal medicine, primary care, whatever. I think the movement is for addiction medicine is to become much more broadly. It's not just a subcomponent of psychiatry anymore. And so the first thing is just don't be afraid to start to address that issue. Any attention or intervention is better than nothing, right? And so, you know, with smoking and you know, for other substances too, just simple physician advice, even though you think it's like nothing, those things can move the needle. And you're talking about earlier, David, about how people how do you move them along? You know, just because someone says they're not going to quit using today doesn't mean that your intervention of advice and providing them resources, oh, here's a free app, go look this app, go call the quit line, you know, go out here's information about local Alcohol Anonymous groups in your area. Just because they say, nah, you know, but if they go home with that information and they're closer, the stages of change, right? What we call in psychology, they go from pre-contemplation to contemplation, right? And so now they're contemplating. And so all those things I think make a difference. And then, you know, if someone is ready to quit, then, you know, of course, referrals to specialized treatment. And then, you know, in terms of nicotine, and in adults, you know, all physicians can handle pharmacotherapy, prescriptions, and you know the risks are really not low. There's not really any. There was previous concerns for some of the pharmacotherapies, like you know, Zyban and for Chantix for psychiatric black box warnings. Those I think have now been eliminated with future research. Which has shown that those are not really concerns. So yeah, I think there's a lot you can do just in kind of general primary care outside of psychiatry.
For most people, substance use of substances is a coping mechanism, either, you know, for stress or it, you know, the habitual nature and the way people integrate it into their daily lives. It seems like certainly exploring mental health supports couldn't be, as you said earlier, Adam, it wouldn't be harmful, right? You know, people need healthy ways to cope, and maybe it doesn't rise to the level of a, you know, a disorder. But you know, the challenges of removing an addictive substance from someone's daily life it's a big challenge. And so I think if supports are available, it seems like definitely something worth exploring.
Well, this has been a great discussion. Thanks so much for the effort you put into this, and also for the content that you've provided for our audience. Thanks very much. You helped get us closer to taking care of these individuals that are challenges and that are challenges to their own personal health. So thanks very much. Appreciate it.
Sure.
Thank you, our pleasure.
Yeah.
Bye-bye.